Well, there's growing concern about the possibility of another winter COVID surge.
Cases of COVID, RSV, and flu that we've been talking about for weeks now are all rising as people get ready to gather for the holidays. UW Health Chief Quality Officer Dr. Jeff Pothof is back for his weekly visit. Hi, Dr. Pothof.
Hello.
Good to see you.
Good to see you guys.
So how concerned are you about what the winter will bring for us?
I think, compared to last year with Delta, looking at Omicron, not as concerned as I was then, but at the same time, we do have this setup that's kind of happening. We're seeing RSV cases that are very high. We're certainly seeing more influenza. That's coming soon, and COVID's starting to tick up, which is expected as we come inside. So that could create, some demand on our hospital services. Not that all those folks all get admitted, but if there's a large number of people, even a small percent that get admitted, can sometimes keep us really busy.
Yeah, and adding to that, you had mentioned in the clip we showed earlier, new parents are not taking any chances with their kids maybe having something, so they're coming in. Is that adding to some of the pressure?
Yeah, I think this is understandable. So with the precautions we had during the pandemic, we have about 2 years of new parents where their child hasn't really gotten sick yet. And now we do have all these things that are making kids sick, and they're trying to figure out, like, do I need to bring them to ED or urgent care? Do I need to call the pediatrician? And I think that's adding to it a little bit.
So you're seeing an extra high number of cases in the ER and at the urgent care?
Yeah, absolutely. So record volumes right now of patients presenting to our urgent cares and even our emergency departments, which I think the message there is if you're having a life-threatening emergency, we absolutely want you to come to the emergency department. You shouldn't be sitting at home clutching your chest with chest pain or wondering if that facial droop is going to go away. But if you're wondering if you should go to the ED or not, it's certainly maybe not something that's evidently life-threatening. Talking to a primary care provider first is a great idea. Using our digital platforms, I think, is a great idea, where you can log in the comfort of your home, either on your phone or on a laptop, and have a provider interfacing you via that video chat to say, yeah, I think maybe this is something that's a little bit more severe, or, this is okay, here's some prescriptions, and helping you out that way, just to avoid those waits that we're seeing in those environments right now.
And I'm sure a lot of people want to get checked out as we approach the holidays, which reminds me is now a good time to start getting another vaccine, a booster, if you haven't done that already.
Yeah, so like time is running out, but if we look at how these boosters work, if you get one right now, we start to see that rise in antibodies at about day 10, and then it peaks at about day 14. So for Thanksgiving, you'll probably be not quite at peak, but you'll have some protection. But if you get it now, you'll be in really good shape for Christmas.
Are we still getting tested before gatherings? It doesn't seem like people are really doing that anymore. And now when you add flu and RSV on top of it, what's your guidance for the upcoming Thanksgiving?
That's a great question. Whether you test for COVID or not, that's an option. But I think more so, these are the things that everyone knows we don't often do. If you're not feeling quite well for Thanksgiving, don't go. What I hear frequently now is like, hey, I got a little something, but I'm COVID negative. And I'm like, but you still got a little something, so maybe kind of stay a little bit away, because it could be RSV, it could be influenza, it could be something else that none of the rest of us really want to get.
Yeah.
So that's an important topic then. Just because you don't have COVID doesn't mean other people aren't immunocompromised or could have serious ramifications if they catch the little thing that you have.
Absolutely. Like, I'm glad you didn't give me COVID, but I didn't want influenza either.
No.
You know what I mean?
Well, COVID is still with us.
Yes.
And as you said, now that we're all indoors and winter is here, hopefully it's not going to get unmanageable.
Yeah, I think we'll see an increase, but hopefully not so much that it causes us problems in the health systems.
And is it also good advice as we approach Thanksgiving to be careful of the sharp knives, don't deep fry a frozen turkey, speaking of ER
I'm
stuff?
telling you, there are like all kinds of things that we start to see in the emergency department, but certainly if you're going to fry turkey, make sure that oil level is not going to boil over. That'll create some problems. Don't cut yourself. Be careful with those knives. There's all kinds of things you can get in trouble with during the holidays.
Maybe wait to have cocktails after you're done cooking.
Yeah, that's probably a good idea.
All right, Jeff, well, have a great Thanksgiving. We probably won't see you until after Thanksgiving, right?
You guys too.
Great to see you.
Same.
And we'll be right back.